The stock market finished the week on yet another high note. The Nasdaq closed at a record. The Dow and the S&P 500 almost did. And even with a number of developments out of Washington, investors were focused on the possibility that corporate profits will be strong this quarter and that global economic growth will continue to improve. Today, the Dow Jones Industrial Average rose 30 points to 22,871. Nasdaq was up 14 to that record, and the S&P 500 added 2. For the week, all of the major indexes were higher.
The market may have risen even more today if not for the decline in the healthcare stocks. Shares of hospital operators and insurers were lower after President Trump said the administration will immediately stop making subsidy payments to health insurers that sell plans under the Affordable Care Act exchanges. Those payments are used to offset the cost of coverage for low-income people. And as Bertha Coombs explains, that leaves a lot of questions about what happens next.
President Trump says he's cutting off what he calls subsidies to health insurers.
That money is going to insurance companies to lift up their stock price, and that's not what I'm about. Take a look at who those insurance companies support, and I guarantee you one thing, it's not Donald Trump.
Those CSR payments, or cost-sharing reduction subsidies, are used by insurance companies to lower out-of-pocket costs for 6 million people on Affordable Care Act plans. The president's move won't make much difference for them.
Insurers will still have to pay for those subsidies, though, themselves, right? They're required to by law.
Without action from Congress, exchange insurers could have to absorb subsidy losses in the fourth quarter, which analysts say will hurt smaller regional carriers the most. But for 2018, with open enrollment set to start November 1st, most carriers have already priced in large premium increases to account for the loss of CSRs. Those higher prices will actually cost the government more than the subsidies themselves.
The effect of that will be the premium subsidies will also increase. The one thing that's kind of ironic about the effect of this is that it will actually increase the federal spending on low-income persons in the exchanges by about $365 billion over 10 years.
And the Congressional Budget Office expects because of those high premiums, we'll see an attrition of about 1 million people dropping out of the exchanges for next year. But the big question is what the insurers will do about the individual market beyond that.
At a certain point, you say, this market's just not worth it for me anymore. I'm going to sort of take my marbles and go to a more profitable market.
Insurance groups expressed concerns about the president's move and urged Congress to act in a bipartisan fashion to stabilize the exchanges. But as one analyst put it, with open enrollment just 3 weeks away, it's now going to be up to the states to try to shore things up. Bertha Coombs, Nightly Business Report, New York.